All right. So, welcome everyone. Thank you for joining us here today for our webinar on how you can access respite services here in Washtenaw County. We're going to have representatives from 3 different organizations, and we'll also talk a little bit about what we do here at Jewish Family Services. So just to orient us, this should take about an hour, and we are also recording this and we'll send it out to anyone who has registered for this webinar after the recording is uploaded to the cloud. We'll also share any resources that the agency send to us. If you have any lingering questions, you can direct them to me and I'd be happy to relay them. All right, so
And it
just to
will
get us,
also be on our website. And
yes,
we'll
it will
put it on
also be published on our website. So if you can't access it via email, it will be there as well. All right, so just an orientation to the CARES program. So I am a CARES intern and we fall under the WISE umbrella. So WISE services through Jewish Family Services, they're intended to assist our older adult population. And then we're under that umbrella, but we work specifically with caregivers to help with ease some of the burden that they experience. But as you can see, we're under just one of the umbrellas that JFS has here. We have a variety of other resources. So if you have any specific questions or concerns about some other areas where we might be able to assist you, please also feel free to email me and I can direct you to another department if you have some concerns about counseling, nutritional support, transportation, etc. And then just to talk a little bit more about the services that we provide specifically through CARES, I'm going to pass it over to my supervisor, Roberta, and she'll tell us a little bit about how you can access respite through us and also some of the other services we provide.
Thank you, Callie. So as some of you know, I'm Roberta Hershon and I'm the manager of the CARES program. Our CARES program is caregiver assessment, respite, education, and support. We work with you, the caregiver, attempting to help you deal with whatever concerns you have as a caregiver and navigating what can be such a difficult and challenging job, but also very helpful and beneficial. But we know that it's stressful, it can be stressful, and there are lots of pieces of it that sometimes we're just not equipped or aware to deal with. So we want to be there to help you navigate that system. We are also very committed to respite. And from my perspective, respite can be one of the lifesavers for caregivers as well as care recipients. It gives caregivers a break to take care of themselves and work on their own things and just take the time that they need to recharge and rejuvenate. So because of that, we do have a small grant and do provide up to 48 hours of no cost respite for clients. That money is usually taken up very quickly, and as it is this year, so it's high in demand because there are very few places that have any supports for respite that is no cost to clients. But if you need anything or have any questions, give us a call and we'll try and work together to resolve whatever those issues are and find the resources that you need to be successful as a caregiver.
All right. Thank you, Roberta, for that. Again, I would like to encourage anyone who's on this call or watching after the fact to always email us if you have any concerns. Odds are, if we don't have the resources on hand, we can always point you in the right direction. So just wanted to highlight that again. And now I will pass it over to one of our first speakers here. So we will have a representative from Ageways, Alex Harrison. So I will pass it over to her. And Alex, if you need me to stop sharing my screen, just let me know if you have slides. Otherwise, take it away.
Okay, perfect. Yes, I do have slides, so I will share my screen now. Let's see here. I remember, here we go. I usually use Teams, but let me know if you guys can see my screen. We're good? Okay, awesome. So first of all, thank you for having me. My name is Alex, and I do communications here with Ageways Nonprofit Senior Services. I don't know how many of you are familiar with Ageways, but we were we are familiarly known and used to be known as Area Agency on Aging 1B. So that was a little bit of a mouthful, kind of hard to remember. So we switched it up about 2.5 years ago, and we did a rebrand and came up with Ageways. So that's what you might hear us called more in the community. So for those who don't know what we do, we are a nonprofit. We're state funded. And we offer a variety of programs to not just seniors, but their families. And we cover 6 counties. So we cover Livingston, Macomb, Monroe, St. Clair, and Washtenaw counties. And then we have sister agencies in Wayne County and actually all over the country. But a lot of people ask us, about Southeast Michigan. And while we cover quite a majority of it, we do have those sister agencies in Wayne County, which is awesome. But then again, if you have loved ones in Lansing and or up north, then we have area agencies on aging that can serve your loved ones there. If you're curious about the ones in Wayne County, we have the Detroit Area Agency on Aging, 1A, and then we have the Senior Alliance. And basically, Detroit, they cover the city of Detroit as well as some of those more populated cities like Hamtramck, Highland Park, Grosse Pointe, and Harper Woods. And then the Senior Alliance basically is the rest of Wayne County. So in this presentation, we will talk about some of our services, but we're also just going to kind of talk a little bit about the reality of caregiving. And most of you are, I'm sure, will be nodding along because this is the life that you are living, but we're just basically here to help in any way that we can. So we start off by saying that caregiving, of course, is rewarding, but it's also tough. And that, I feel like when you're caregiving, you're usually juggling, not just caregiving. It can never be just simple, right? It's usually, you might be doing your own job, you might have work, parenting, you might be in that sandwich generation. And a lot of caregivers, they just don't know where to turn for help. So we hear a lot of people say, I feel like I'm on call 24/7, or they'll meet us at like an event and they're like, I wish I knew about you guys when my dad was still alive. Or, I would be I used to take my mom to all these doctor's appointments and they would always ask how she was doing, which is good, but no one ever was checking on me. So, I feel like with Ageways and just in general, we really try to emphasize if you can't take care of yourself, you can't take care of the people that you love, right? So admitting that caregiving can cause family conflict and resentment is really important because that is a very real thing. And just know you're not alone. Over 52 million Americans are in this role. So our biggest thing we want to push today is that you don't have to do this alone, and you shouldn't. And we start off by giving about 5 steps just to support yourself while supporting an aging loved one. So number 1 is understanding the needs. So your mom, dad, aunt, grandma, whoever you're helping, sister, spouse, what's their condition? And try to plan ahead if you can. Evaluate what do they need help with today. You can start out by making a list. How will their health or behavior change over time? Will they be able to stay in their current home? And you can talk to doctors or have a geriatric assessment. You can talk about disease-specific support like Alzheimer's or Parkinson's. Again, you do not have to do this alone. And excuse me, I might be taking some water as I present here. Step 2, know what help exists. We always tell people if you walk away with anything today, we want you to remember our number, which I will share at the end, we can also put it in the chat. It's our 1-800 number. We want this to be the first place that you call if you have any questions. So there are area agencies on aging like Ageways all over the country, like I mentioned at the beginning. But of course, there's also faith-based and volunteer organizations like JFS, of course. There are, friendly callers, there's volunteers, veteran groups, senior centers, respite, meals, and transport. And just remember that even if you're long distance, services exist where they live. My mom and I, we talk on the phone a lot, and she's like 30 minutes away. But my grandma, her mom lives out west, about 2,000 miles away. And my mom said, she's not, my grandma's reclusing. She's not going out anymore. She doesn't want to go to the pool anymore because she's afraid of falling. And I said, well, Ageways offers a matter of balance costs. I wonder if the area agency on aging near her offers one. Well, I looked it up today and they don't, but there is a healthcare system about 15 minutes from her that offers a class called Defying Gravity, which I personally love that title much more. And it's the exact same thing. It's where she can go and learn more about falls and fear of falling and what to do if you fall. So don't worry, there are resources all over, which is amazing. Step 3. There might be some legal tools that you'll need. So you want to make sure that you and your loved one are protected. There are things like a durable power of attorney, healthcare proxy, looking at the differences between a will, a trust, and a living will, because they are different. Looking at a caregiving agreement, especially if you have your loved one has Medicaid, and knowing your state's CARE Act requirements. So it doesn't ever hurt to, try to consult a certified elder law attorney when you're navigating this. It's just good to know what's out there and what might be best for your family. Step 4, I should say, don't be afraid to get some extra hands. You can't pour from an empty cup, as we were talking about earlier. And some of the options that can help you might include in-home care, whether that's government funded or private agencies, adult day programs. Think of that as like adult daycare. We like to call them adult day centers. This is where, your loved one might not live 24/7, but if you need to go to the grocery store or need to run some errands and just have some alone time and your loved one isn't able to be at home alone, then this is a great way for them to have supervised and engaging care with other seniors. So there's a lot of socializing and games, and sometimes there's even medication administration if that's needed. Don't be afraid to ask friends and family for specific help. Can you take so-and-so to their appointments on Wednesdays? And like we mentioned earlier, faith and community services like Meals on Wheels or calling programs. Just remember that if you are hiring a caregiver, vet them like you would a nanny. Experience, backup plans, personality fit. Those are all really important things to look at. Step 5, take care of you. We're just going to nail this one in the head till we all get it. Burnout is real and it's dangerous. So I know these are, sometimes we think of certain feelings as like bad feelings versus good feelings. But I think that we're all human, so we're going to experience everything. And sometimes, this is one thing I've learned in my life, that sometimes we can feel two things at once. We can feel happy, but we can also feel tired. We can feel grateful, but we can also want more. And, you might feel guilty about having resentment towards the person you're caregiving for, but it is a very real thing. And so is exhaustion and anxiety and depression and isolation and even health issues. But just know that there are options out there for you. There's support groups, adult day centers, like we talked about, setting realistic expectations and boundaries, and giving yourself permission to breathe. My parents, thankfully, we're not quite there yet, but my mom will make comments to me, and I'll just be honest with her because I am the only sibling nearby, and I'll say, that particular need is not something that I have a lot of skills in, but I am good at researching and I am good at organizing and planning, so I can help you find someone who's good at X, Y, and Z. So just kind of being honest with yourself and knowing what's going to work for you as well. So kind of diving a little more into the programs and resources that we offer for caregivers. We have our information and assistance department. This is that 800 number I was talking about. So like I said, if you take anything away from this call today, 1-800-852-7795 is the number on the screen, and that is going to be our free helpline. if you have any questions about our programs or what's available out in the community, because while we do offer a lot, thank you, Callie, for putting that in the chat. While we offer a lot, we don't do everything, and so we do have quite the amazing team who they vetted a lot of community resources, and they can refer you to programs that might be able to help if we can't help directly. And again, we just want this to be the first place to call if you or your loved one needs help. Kind of going with this information and resource line, we have an amazing resource guide. It's the Connect guide. It's probably like this thick, nothing too crazy, but it's really well done. We do it about every 2 to 3 years. And the first half of the booklet is articles that might benefit family caregivers or older adults, whether that's information on long-term care, or I don't know, I keep skipping ahead of me, sorry about that, or mental health or transportation. There's a lot there, but in the back, which is one of my favorite features of the book, is a local resource listing, and it's organized by our 6-county region. So you live in Washtenaw, you're going to go to the Washtenaw section and you're going to look, it's going to be organized not just by county, but also by service need. And then you'll have some options underneath that. And we can, if you want one of these, we can mail it to you for free. We can mail you a whole box. I think we mail up to 25 at a time. But if you prefer to access it on your phone or laptop or iPad, you can also access that PDF on our website for free. We offer an amazing program for family caregivers called Powerful Tools. And this is like a 6-week workshop. It helps caregivers learn strategies to take care of themselves. Classes are usually on the smaller end, like 8 to 12 people. And I feel like going through the class helps people get to know and learn from one another. I know that when I'm going through something hard in my life and I am able to talk about it with like a friend who might have, whether they're also going through it or they've gone through it in the past, it always feels so validating. I'm like, oh my gosh, I'm not the only one. And then usually they'll, they can kind of give me like tips on what's worked for them. And that can be really helpful as well. So we know that gathering is really important for people. And we try to offer these not just in person, but virtually, because we know caregiving can be a time or like your time is very limited. So definitely keep an eye on our calendar for upcoming classes. We have a newer program called the Caregiver Community Connection Webinar Series. It's a little bit of a mouthful. I abbreviate it to C3 webinar series, but the girl that runs this, Taylor, she is like stellar. She gathers basically experts from the aging and caregiving community each month and does a webinar series or a webinar that month where the specialist will speak on a certain topic, and then there's time for the participants to engage, ask questions, and then connect with one another. Kind of similar to that previous class that we talked about as far as, the making, I don't like to use the word networking, but just getting to know other people who might be going through things similar. And these sessions are free, just like all of our services. And if you can't join live, we do post on our website and our YouTube channel. We also have partnered with a website company called Trualta. This website usually costs quite a bit of money, but when you sign up through Ageways, you actually get access to it for free. And this is an online knowledge platform. So you're going to get short videos and articles on caregiving topics that are gonna, they can help you get answers in the moment. It's usually monitored. There's chat forums that are monitored. Oh my goodness, by the people and at Trualta. And then you also have experts like Tipa Snow. She's kind of known as like the dementia guru. She and other experts will publish, thought leadership help on there, which is great. And then as well as the chat forums, you have peer-to-peer support groups and webinars, which is great. Caregiver respite vouchers. I'm not going to go through this slide because this program is currently like in it's like paused, but usually what happens is family caregivers can apply to receive up to $575 via voucher to spend on respite care, and that usually starts at the beginning of the year. So keep your eyes out for that. We have a newsletter called Care Hub. This is a great way to stay informed with the latest services that we're offering. We like to share caregiver tips where we can, advocacy, community news, different things like that. So that's a great way to just get straight to your email if that's something that you check regularly. We offer a couple of other services. So if you have any questions about this, I'd be absolutely more than happy to answer them. We have a great team, My Ride 2. They manage transportation assistance. We have a long-term care options counseling. That's for people trying to determine next steps for where to live. We have a great team that is doing that, as well as a team that helps with Medicare counseling. We have an upcoming program for mental health that's hopefully going to start soon. We've talked a little bit about some of our health and wellness classes. We offer more classes just for older adults, which is great, including a dementia simulation class, a matter of balance class, and a bingo size, which is like exercise and bingo combined, which is kind of a blast. We offer a program for weight loss. And again, all free. We also have a great advocacy team. We have an ombudsman team. Those are advocates that can help resolve disputes in long-term care facilities. Aside from all of those programs, we help fund programs in the community like Meals on Wheels, grandparents raising grandchildren, community dining. That's where you can come together and have lunch with friends. Kind of get out of the house, especially when it's gloomy like this outside, chore assistance, home injury control, community liaison services, volunteer caregivers, and then, of course, prevention of elder abuse awareness and education. So do you guys have any questions for me?
I'm just going to jump in real quick. We're going to save questions for the end just so that all the speakers can go through.
Perfect.
But yeah, as questions come up, please, everyone who's participating, write them down. We're going to have a dedicated space, and you can ask specific agencies questions or just kind of throw a question to the group, and we'll be able to answer that panel style. So
thank you so much, Callie.
Yeah, thank you so much. I appreciate that. We're going to pass it over now to Angelique from HomeWatch Caregivers to tell us a little bit more about the services they offer.
Sure. Hi, thank you. I appreciate that. Let's see. I don't have slides, but I do have a flyer that I'll share when I get to that part, okay? So I'll just let you know when I get there. As mentioned, I'm Angelique. I am the Vice President of Client Services at HomeWatch Caregivers. We are a private duty home care located in Ann Arbor, Michigan. But we do service other areas as well. So the Ann Arbor office in particular services Washtenaw County, but we're also one of the home care providers for the Huron Valley PACE program. And so that program, we do service Monroe County for them specifically. But we do have a second location in Novi, and that Novi office covers parts of Wayne County, parts of Oakland County, and even Livingston County. So it's a pretty large territory that we do service. And usually we have anywhere from 100 to 175 clients at a given time that we're providing care for, and usually anywhere from 100 to 130 caregivers currently on our staff. So we've been in business since 2008. And again, there's tons of things that we do, but primarily, as I mentioned, we're private duty home care. And so what that means is that we are a non-skilled home care company. And so I'll share my screen now that just talks a little bit about the services that we do offer. Give me 1 second here. Let's see if I can get this shared. All right. Let me know if you can see the screen once I get it up. Okay. Let me know if those services popped up. Okay, perfect. We offer a lot of services, but it's funny because I usually get the question, what all can you guys do? The funny thing is like, really, the question is kind of really, what don't we do? That's really the place to actually start from. One of the things that we do is we do provide personal care for any of the clients that we care for. So personal care looks like a lot of different things. It can be actually physically helping someone with their personal care, meaning bathing, dressing, toileting, providing hands-on assistance if they need transfers or if they need standby assistance, meaning that someone is with them at all times when they are moving around or ambulating to make sure that they are safe. But we do a lot of other stuff too. So we help with grooming, oral care, we can even assist with specialized equipment such as like feeding tubes or even helping to empty an ostomy bag or a colostomy bag. So it really is based off of whatever the client's diagnosis is, as well as the different type of equipment that they may have medically. In addition to helping with personal care, the other things we're able to do is help with light housekeeping. So light housekeeping, though, is very specific, meaning that it does have to be what we consider light housekeeping, though. That can mean helping with bedrooms, bathrooms, living areas. So whether that's mopping, organizing, sweeping, doing different things like that. We can help out with laundry, changing bed linens, and we can even help out with meal preparation. Meal preparation could mean that we are completely providing a meal for someone, meaning that the caregiver that you have is inside of the home and are actually preparing that meal. But sometimes people prepare their own meals and they just need us to warm up something that's already in the refrigerator and it's been prepared by another loved one or actually prepared for like the client. In that case, we would just be warming up a meal. Care really is what a person makes it out to be, though. One of the things that we're really big on is trying to make sure that our clients maintain as much independence as possible. So sometimes we're actually cooking a meal with the client. Like if the client is still able to maneuver in the kitchen, they're still able to do certain things with their hands. Let's say that they're able to help with certain parts of making a salad, but they need assistance with chopping up the lettuce. Then what we'll do is work with the client and we do the parts that their hands can't manually do so that we're working at it together. That's the same thing with personal care too. We try to make sure that the client is able to maintain their own independence as much as possible. So again, sometimes we are physically having to bathe someone or dress someone, but a lot of times it may be as simple as helping someone get in and out of the bathroom or into the shower. And then maybe they're able to bathe themselves once they're in there, but they just want somebody close by in the event that they need something or to make sure they are safe while they're in the bathroom. So we can do it that way as well. Sometimes it's as simple as, hey, I can bathe myself, but I need for someone to actually help me with washing my hair because maybe I can't reach up because I have issues with a rotator cuff or something like that. And so we provide assistive, supportive services as well. The other things that we are able to do is we are able to help with what we call companionship. Companionship looks like a lot of things. It can be as simple as watching TV with someone, completing activities together, maybe listening to music or playing some games together. But it could also be providing transportation. Sometimes we are helping someone to go run errands. Sometimes we're taking them to a doctor's appointment or even just special outings. I have a lot of clients who sometimes want us to take them out to lunch, or maybe they want to go get their hair or nails done. It really is up to the client on what they want those services to look like. Um, and so I try to make sure that when I'm speaking to families that I'm explaining to them that the sky is the limit. There's tons of options for what it is that you could be doing with your client. And there's tons of things that your caregiver can actually do for you and the care that they can actually provide for you. So that's just one of the things that, I like to explain when we're providing care. Again, tons of things that we can do, but this is just a list that kind of breaks it down so that at least the client has a place to start from, so they have an idea of some of the things that we can provide when we're in the home. So I'll stop sharing at this point for that screen. And then, part of the way that we provide care is several different ways. So again, because we're a private duty home care, that means that we have clients that pay for our services privately, meaning that maybe they've contacted us by going to our website. Maybe they have gotten a flyer from somewhere and heard about us. But it could also mean that they maybe have had a loved one or a neighbor or someone that has used our services in the past, and they want to now use services themselves because maybe they've heard about us. The other way that we provide care is through programs. In particular, we do work with several organizations in the community, and we provide home care services to those programs through grant services. And so there's a lot of programs that have grant funded programming that will pay for our home care services. In particular, we work with Jewish Family Services on the CARES program, and we provide respite care to family caregivers that essentially need a break from home care for their own loved one, or it could be different reasons why someone may need us to come in. Sometimes it is as simple as needing respite care or just needing a break. But sometimes it really is because that person does need assistance with personal care. And maybe the loved one is having a hard time being able to manage that by themselves. And so, again, the variation to why we provide care varies based off of each person that we provide care for. A lot of times I'll get asked when I go out and I meet with a person who might be thinking about home care services, I don't even know what to do if I had a break. And that's one of the questions, that we get asked often is like, what can I do? Or what would you even do if you came out? And so a lot of times it's helping someone to understand that a break simply could mean as simply as maybe I just want to go read my favorite book that I haven't been able to read in forever because I've been providing care for my loved one for so long. It could be as simple as I want to be able to take a shower without having to worry that my mom or my dad might potentially fall when I'm in the shower. And maybe you just need a caregiver to be there to provide care for just that moment so that you can be able to take a shower for yourself. It's as simple as small things like that why caregivers are sometimes really helpful. And then, of course, there's people that need us because they maybe do have to work or they do have to leave home and they want to make sure that their loved one is safe while they're not there with them. And so the biggest thing that I would always tell people that we provide is technically peace of mind. It's peace of mind that your loved one is safe if you have to be away from the home, but also it's peace of mind if you are home and you just want to take a break for yourself to get some rest or be able to do something for yourself. I believe the last speaker just spoke about that, mentioning, how important it is to make sure that you are taking care of yourself. As a caregiver, we have to make sure that we are okay mentally to be able to take care of our own loved ones. And keeping ourselves well is a part of that. And so sometimes hiring a home care company can help to do that so we can make sure that we are mentally okay to be able to take care of our own loved ones. So, how does a person, set up care? Essentially, again, if they have contacted us through our website, which they can do, what usually is going to happen is someone's going to answer the phone and do a intake with the person that calls. Usually the intake is just a few brief questions just to get information about what it is that you might be looking for, who the care services are for, and how soon you want care to start. After that, I usually am the person who's going to come out. I call it an evaluation. It's completely complimentary to any person that I go out and meet with, especially if this is a person that is paying for care privately. So it's a complimentary service for me to come out, talk with them a little bit more about what it is that we have to offer. But really, it's more so me just learning more about that family. It's my opportunity to educate them on things that they may not know exist in the community. So a lot of times I am out and I'm talking about some of the services that we're going to hear from today, and talking about resources. Everything that I do is not necessarily about me specifically and the home care that we can provide, but it's about how, as a community, we can help to take care of the individual who's seeking services. After that evaluation, they then can maybe decide that they do want to move forward with care. For us, care does not have any limits to it. We don't have any stipulations. There are no minimums related to how much care a person can have. There's no hourly amount or anything related to that. It more so is anywhere from 1 hour all the way up to 24 hours of care for someone who wants to pay for care services privately. Again, under some of our programs, though, there are specific stipulations to like certain amount of hours that you do have to have. But again, those are related to specific programs that we work with. But typically, it is pretty open-ended on how much care you have. I always jokingly tell people, I've got clients who utilizes our services anytime they need a new joint replaced. And so, they might need a hip replacement 2 years from now, and then they call us back in 2 years. And then they don't need us again until then. So we're, kind of always in the picture, always part of someone's life when they actually need us at that time. And then there's some people who need us a little bit more frequently than that, so we can be in a person's home every single day. But again, we could also be there just for specific things that may be needed as well. Once the care is started, typically what a person can expect is to have caregivers come into the home. Usually, someone from our office is going to come out and do a formal introduction the first time that a caregiver steps into the home. And again, that's for that peace of mind to make sure that the family is comfortable, also making sure that the caregiver is comfortable with the care that they're going to be providing. And again, just be there to troubleshoot any type of questions that someone may have during that time. After the care has been established with the caregiver, I always remind people we try to aim for consistency, meaning that we try to make sure you have the same caregiver coming out as often as possible. But again, sometimes there can be variations to that depending on if a caregiver gets sick or a caregiver is not available. We will always then just send out a replacement if we have to send someone out. But again, it helps to have a very consistent schedule because, as you can imagine, the caregivers also like consistency. They like to know every Tuesday and Thursday from this time to this time, I'm going to see this person. So having a consistent schedule also helps with the consistency of getting the same caregiver. They also have access to us 24/7. So we are a 24/7 home care, meaning that you are able to access our number at any time. There will always be a person who is available to take calls after hours, whether it's on weekends, or anything that you might need as far as an emergency may go. I know a lot of clients have my personal cell phone number, and I am available, obviously, if there's an emergency or something that you need. But honestly, the best way to be able to reach us is to use that main number. And I saw you posted a number. I'm going to give one more number that's a little better to use. The main number that you want to use is 734-622-8190. And that's 734-622-8190. That is access to our 24/7 line. After hours, you will get a voice prompt that just says, hey, you've reached us after hours, but press 1 or 2 if you want to talk to someone, or press 1 if you want to leave a voicemail. And so you just have to kind of listen to that prompt so you can make sure that you get to the correct place that you're looking for. But outside of that, we do provide quality visits where we come out, we see how things are going. We ask questions about if you like your caregivers. That's one of the good things about it is you're not stuck with the caregiver. You have the right to decide who's in your home. You have the right to decide if you'd like to try out a new caregiver. And then we just start the process again and we will introduce a new caregiver to you. So again, tons of different services that are available. It really is a flexible type of service that you kind of make it whatever you want it to be. If there's questions, again, I'm always available to be able to help answer questions or be able to help navigate other resources that a person might need as well. But again, if you do have something that you need, don't hesitate to just reach out to the office. There's usually someone available 24/7.
Thank you so
That's it.
much for that. I appreciate it. And I just edited in the chat. So if anyone wants to write down that number, it is right there for your convenience. Again, that's the line that you can call anytime and they'll direct you to the right place. So thank you again for telling us a little bit more about Home Watch caregivers. I
Sure.
appreciate it.
Thank you.
All right. And then we have our final speaker today before we move on to Q&A. So we will be talking with Kayla from the Alzheimer's Association of Michigan.
All right. Hi, everyone. Thank you so much for having us today. As Kelly mentioned, I'm Kayla from the Alzheimer's Association, and I'm going to talk about our programs and services that we offer, including our Respite program. So a little bit about the Alzheimer's Association. So our vision is a world without Alzheimer's and all other dementia. So we don't just service folks who have an Alzheimer's diagnosis. It can be any type of dementia diagnosis or just a concern or anything. We're here for you. The Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction, early detection, and maximizing quality care and support. And so now I'll talk about those services that we offer. All of our programs and services are completely free. We don't have any income eligibility requirements. There are a few requirements that I'll talk about, but just again to preface, all of our programs and services are completely free. So we have our 24/7 helpline. So this is for anybody to call looking for, whether it be resources, disease information, want to, talk through a scenario that's going on. Maybe it's a behavior, maybe it's those communication changes, whatever it might be, we're there for you 24/7. We have lists of, adult day programs in the area, in-home caregivers, whatever it may be that you're looking for. This is a confidential line. It's available again 24/7, 365 days a year. And we do have a language line. So our helpline is offered in over 200 different languages. So if you ever need anything, please give us a call. We do also have an email if you're just looking for information as well. And this can also be the gateway to getting started with any of our programs and services. So if you see something that you might be interested in getting more information on, you can always call or email us. We offer support groups, so we have a variety of support groups. Most of our support groups are going to be family caregiver support groups. We offer those virtually or in person during the day, in the evening, at a variety of locations and times. But we do also have more specific groups. So that can be for that younger onset caregiving experience, early stage caregiving, living with the disease in the early stages, for male caregivers, Spanish speaking groups, those aging with Down syndrome, and those experiencing grief after loss as well. So again, these are offered all throughout the state. We cover the entire state of Michigan here, so these are offered throughout. We do also offer free education programs in the community. So that kind of ranges from that building brain healthy habits, so that how do you lower your risk of developing the disease, to understanding what Alzheimer's and dementia is, all the way to what are these behaviors, how can we respond to them, what are those communication changes, what is caregiving. We talk about all of those different variety of options. So again, these are just like our support groups offered virtually or in person throughout the community during the day and the evening, a variety. So again, trying to be as flexible as possible with those. We have our care consultation program. So this is a statewide care counseling program, again, at no cost. It's a short-term program. So typically 6 weeks, 6 months or less. So it's working one-on-one with a social worker. So maybe it's those behaviors that your loved one may be experiencing. Maybe it's, driving and taking those keys away. Wandering concerns, just understanding the disease and creating a care plan. So that is working with the social worker to create a care plan and see what other resources might be needed to assist. So again, this can be offered over the phone, in person, or virtually, and completely free. We do offer a social engagement program. So this is designed for a caregiver that can be a friend, a family member, a paid caregiver, whoever wants to come to these programs, along with the person living with dementia. So we offer free social and cultural opportunities throughout Metro Detroit. So these are just a few of our community partners. We offer a monthly calendar of programs, and we send that out, and you get to, register for whatever it might be that sounds like something you would be interested in attending. They're typically about 2 hours or less. And I always like to say, we're never trying to see the whole zoo or the whole museum. We're going to see very specific spots. We have a tour guide, and they will take us and go through kind of a short program and allow us to kind of have the time to socialize and learn more information. So those are, again, completely free, and we have a monthly calendar that you can see, or it's also listed on our website as well. We do offer wandering support. So we know that 60% of people with Alzheimer's will wander at some point during the disease. So we offer wandering support. So the two listed on the screen are just two of the options that are available. So we offer free scholarships for people to get wandering support. So again, no income eligibility requirements, and this is offered statewide. So one of the options that people look at is that Medic Alert Safe Return program. So this is getting that ID bracelet, and it says that you have Alzheimer's or that you are a caregiver for somebody with memory concerns. And then it links to a health profile that if someone were to find them, or if there was an emergency or an accident that you were in, they would know to call that number and find out, who you're caring for. It has emergency contacts and all of that. So with these programs, we cover the fee and the jewelry for these programs. And then after that, there is an annual fee that can occur. That would be what you would be responsible for. But we cover the initial cost as well as the jewelry that is of choice. So it can be a necklace, a bracelet, whatever it may be that you think you or the person would want. We do also offer other wandering support. So it just varies based on what it is that you are looking for. And then to kind of wrap things up into respite care, we offer our respite care assistance program. So as you kind of heard all of these different things, and we all know that you need a break. And so that is where our respite care assistance program comes in. So it's a one-time $1,000 scholarship that is eligible to people living in Livingston, Macomb, Monroe, Oakland, St. Clair, Washtenaw, and Wayne County. And with this program, it allows you a reimbursement of up to $1,000 for any type of respite care. So that can be provided by a friend, a family member, a neighbor, a paid caregiver, whoever it may be that you want to provide this care, you get to pick. It's totally up to you. And then once that care is provided, you submit a receipt and then we reimburse you for those costs. So it can be, there's no set amount that needs to, the cost needs to be. So if your neighbor is charging you less, you can use more hours. It's really up to you and the person that you have caregiving. Now, this isn't limited to just in-home care. This can also be used at a day program. So if your person is already attending an adult day program or you're interested in that, this can also cover that cost, as well as if they're doing an overnight stay. So if you're going out of town and you need someone to stay with them, or if you want them to stay somewhere, this can also be part of that cost. We know that $1,000 isn't going to, necessarily cover a long period of time or a lot of care, but we want to be able to provide as much support as we can. Again, there's no income eligibility requirements. The eligibility is just living either yourself or the person with the dementia in that service area. So any of those 6 counties, as long as they're in there, they would be eligible. So again, just kind of highlighting, if you're interested in any of those programs or services that we offer, you can find those on our website, as well as if you were to call our 1-800 number, we are always there to answer any questions or get you started in any of those services. Thank you.
All right. Thank you so much, Kayla. I appreciate all the helpful information. And I just want to thank all of our speakers today for being able to come here and educate us a little bit about what resources are available. I do want to leave some space for questions from the audience. So if anyone has a question, feel free to vocalize it now. You can unmute yourself and you can just ask general questions, or if you have a specific question for any of the agencies, go ahead and you can ask that now.
Hi, I got a quick question. It's Anita. Can you hear me? Okay. I was awarded the 48 hours of respite care last year, which we used all of them in like 2 or 3 months, and Home Sweet Home was awesome. And we were awarded again for mom and dad for this year, but I haven't used any of it, and I want to return it because mom is in assisted living and dad is now getting VA assistance with care and respite and whatnot. So I figured someone else might be able to get that. But I think I sent an email to Sarah Weiss. I'm not sure if she was the person I needed to send it to. But if I'm not using it, I'm sure someone else could. So there's 48 hours that I'd like to return.
I can actually respond to that, Anita. I did get your email.
Okay.
I have a draft open that I haven't responded to yet, but thank you very much.
Okay, thanks.
Well, could I make a couple of comments? Can you hear me?
Yes, we can hear you.
Oh, well, my husband and I both got those Guardian security wristbands. The only thing I don't like, they go off too easy. I was at a baby shower and I didn't know it had dropped off my arm onto the floor, and the police and fire department came. But um, anyway, they've been valuable. And we also got that $1,000 scholarship, which we paid a young man for the amount of money we turned in his hours $1,000 worth. So we appreciate all of these things that are very helpful. And we've also used Angelique's service. We've had 24 hours given to us, and we've appreciated somebody's coming tomorrow for 4 hours. And they have done our washing and a lot of different things while I get to go to a book club, or Carl has frontal temporal dementia, and we don't leave him alone much anymore.
Great. I'm happy to hear that you've been able to take advantage of some of these programs that we highlighted today. It sounds like you've had overall pretty great experience there. So thank you for sharing that with us. We have a few minutes left. Does anyone else have any questions for our speakers? All right, and again, I will just reiterate, if you do have additional questions that you didn't vocalize during this meeting, or if you're watching this at a later date, you can always email me questions